Rheumatic heart disease is a chronic, disabling and sometimes fatal disease, though it is 100% preventable. However, in Fiji, it is believed that about 1 in every 50 children has RHD. According to statistics released by the Health Ministry, it claims the lives of around 60 people annually. Tonight, we have our guest with us to explore what RHD is and what the Health Ministry is doing to tackle it. Good evening and welcome to the show.
Good evening, Geraldine.
Getting straight into it, what is rheumatic heart disease?
So, rheumatic heart disease, like the name states, it's a condition of the heart. Specifically, it's a chronic damage to the heart valves, to the valves of the heart that develops over time. It has a couple of stages, and I'll just briefly take you through the stages of how it actually starts. So it starts off with it's caused by a bacteria called group A streptococcus. In short, we call it strep. So it's sort of like any other bacteria, they're all around us, but this group A strep particularly likes to lodge in either sore throats or in throats or in infected skin sores. Particularly in children, they're the most they're the population at risk here. So once starts with a sore throat, most sore throats are viral in nature, caused by virus, so they go away without needing any treatment. They go away with a glass of water with warm water and lemon and ginger, and it goes away. A small proportion of sore throats in kids are caused by this strep, and it's these sore throats that are caused by strep. Sometimes you call it strep sore throats, or strep pharyngitis. It's these ones that, if not treated, then sets off this immune reaction in the body that then causes what's termed as rheumatic fever or acute rheumatic fever. So rheumatic fever, the most common symptoms are, again, in children, most at risk of 5 to 15 years. Most common symptoms are fever, sore and swollen joints. Sometimes they have some abnormal jerky movements, but most classically it presents with swollen joints. Sometimes it moves around from one joint, starts with in the knee, and then move to other knee or an ankle. And then again, if it's not treated, then repeated episodes of this rheumatic fever then causes damage to the heart valves. It causes a thickening and a scarring of heart valves, which is then what's known, when it gets to that stage, that's what's termed and known as rheumatic heart disease. So there's a few steps, and then obviously if it's not treated, then there are complications that result from rheumatic heart disease.
So let's talk about a timeline. You said it happens in stages. How long does a victim need to have the streptococcal infection go untreated before developing ARF, and how long does the ARF need to fester before it develops into rheumatic heart disease?
It's very variable. It can take months to years as well, but can't put a specific time.
So I guess it would depend on the immune system of the individual.
Exactly, and how often they're getting, if they're exposed to this group A strep, and how often they're getting this rheumatic fever without knowing it, and damaging the heart valves without them knowing it. Yeah.
So you've mentioned that it's all comes down to streptococcus, and that, of course, is a communicable disease. That, if left untreated, of course, leads on to ARF, acute rheumatic fever, and then that would lead to rheumatic heart disease. How is that diagnosed, though? Because you've mentioned that it causes inflammation of the joints, also scar tissue on your heart. How do you diagnose it?
So again, diagnosis of there's two different things. The sore throat, the strep throat. It's only diagnosed through a swab. If you take a swab of a sore throat, first, we'll need the nurse or the doctor to have a look in your throat and take a swab, and then when they send the swab off, that's how it's diagnosed. If the culture grows group A strep, then that's that's a group A strep. The rheumatic fever, how it's diagnosed, is a combination of there's some blood investigation, some blood tests, and they sometimes take an ECG or chest X-ray, and also a scan of the heart called an echocardiogram. So it's a combination of those things, and there's certain criteria that doctors use to. It's a combination of these things, of symptoms, of tests that we run to if it fulfills a certain number of criteria, then we can diagnose it as ARF. And the rheumatic heart disease is the same thing.
How prevalent is it in Fiji?
So RHD is common in Fiji. It is a study a study showed that it's as common as, there's a figure of 1 in 50 school-age children. So that's, if we think of our classrooms in Fiji, you know, they're about 40, we're reaching 50 now. So it's almost, we'd say 1 in almost every classroom in Fiji has echocardiographic confirmed, and those are the confirmed cases. So it's quite common.
And how many are diagnosed though in a year? I mean, how many cases do you get, new cases?
In a year? Don't have the numbers off the top of my head, but we've got a national register, a database where we keep record of all our known cases of RHD, and at the moment we've got about 3.5, almost 4,000 cases that we know of that are diagnosed.
We'd like you to go into a bit more detail about RHD itself. Explain to us what happens inside the heart of a person who has RHD.
So the valves of the heart, you know, we've got 4 valves in the heart, and if a normal functioning heart, the function of the valve is to open and shut to allow the blood to pump in and out of the heart to the rest of the body, to the lungs, to pump it well and to pump it efficiently. So when this repeated episodes of rheumatic fever, the process then targets the valves of the heart, they become scarred and thickened, and then as a result they don't open and shut as effectively. Like they can shut and then not shut as well, and there'll be sometimes backflow of blood when it's supposed to be going one direction, or there's leakage, and the whole result, the blood is not pumping as efficiently through the blood to the rest of the body or to the lungs. And then what happens is the heart is, you know, trying to pump harder to pump the blood through these functional valves. And so the heart is a muscle. It's working harder, and then it obviously gets tired, and that's what results in heart failure. I guess it's one way of explaining it.
Before we move a little bit further, I'm just really curious, how does the scar tissue form?
It's a process. It's what's the word? A process that happens in. It's just escaping me. It's blanking. It happens at the biochemical level, that somehow proteins of the heart that are in the heart, and the result of the immune process that's gone on with a rheumatic fever stage, it attacks the heart, and, you know, your immune system is trying to fight it off. There's a process that happens there that just results in the scarring.
Well, thank you for that. I can understand that it is very technical, and there's so much more that we need to go on about it. We'll be back with more after the break. Welcome back from the break. Now, getting back to RHD, we were talking about what causes it and how it's diagnosed, but I'd like to see and learn what happens when it's left untreated, and what are the complications?
Sure. So, like I've already said, if it's not treated, the rheumatic fever, you know, repeated episodes will lead to rheumatic heart disease. Again, if it's not treated at that stage, it could lead to, most commonly, as heart failure, to stroke, to heart palpitations, atrial fibrillations, endocarditis are the other ones. But the main ones that we see all the time are, I'd say heart failure and stroke. And we're seeing, you know, these young people coming in with, you know, with these complications.
Who's more susceptible to it, the age range?
So it's the risk. Population is a 5 to 15. That's when they're most at risk of contracting this ARF, and then just depends on how quickly it progresses to RHD. So it's most commonly the younger people, but, you know, that said, it can, you know, if not treated, it can be manifest later in adults. Most in Fiji, one of the most common areas or places where we pick them up, we diagnose them, is during pregnancy as well, when women come in and they're pregnant, and, you know, and that's when we pick it up, because prior to that, they wouldn't have shown any symptoms of it or known anything else.
So you can attribute it, especially in children, to weaker immune systems or vulnerable immune systems?
Yeah, rheumatic fever and rheumatic heart disease, it's a different immune process reaction that happens. It's a normal, let's see, like a normal immune reaction is, if a bug comes along, the duty or the role of our immune system is fight it off, and you get better. But what happens in this case is it's an abnormal reaction. Your immune system does fight off the strep, but it also then mistakes our own organs as the bad guy, and it attacks it as well. So that's why it's termed as autoimmune. So it turns on itself as well on ourselves. And
right. So what changes in adults that the disease isn't so common in adults?
It isn't so common at all. Well, because it develops. Yeah, you pick it up more when you're a child, and then.
So I think what the doctor is probably trying to say is that because children's immune system is obviously still, developing at that particular stage, they're more susceptible to it. But as adults, we are better equipped. Our immune system is
developed more.
Is a little bit more developed.
So tell us about some of the work that you do as a public health advisor of the RHD program in
Before
Fiji.
we get to that, I was just wondering. We'll touch on that in a while, but still on RHD. We've talked about what happens when it's left untreated. Looking at treatment itself, how is it treated?
So thankfully, there's a treatment for this. It's a penicillin injection. It's called benzathine penicillin, and our people who have rheumatic heart disease or rheumatic fever need to take these injections every 3 weeks or every 4 weeks for a certain number of years. There's a minimum amount of years they need to take it for, and what it does, it fights off the strep bacteria. So once you have rheumatic fever or once you have rheumatic heart disease, that young person, that child, is more susceptible to it coming on again and causing more damage. So the benza, they need to have this penicillin in their bloodstream, in their body, all the time to be fighting off this strep.
How much does each dose cost?
So in our government health facilities, our health centers, nursing stations, and the hospital, it's free of charge.
But how much is it costing the government, though?
In the government, the benzathine penicillin, well, cost-wise, a vial of benzathine penicillin costs at the warehouse level when they procure it. It's I think it's 80 cents per vial.
So it's pretty easy to come across this, especially if you happen to have someone who is suffering from RHD, to take them over and have treatment or get treatment. How long does treatment usually last? And is it completely curable if you take your benza all the time?
So it's the length, the duration of the treatment is it depends on the severity of the RHD. Again, RHD has different severities, there's mild, moderate, severe, and a couple of other factors are taken into consideration when a doctor decides how long they should be on this. But as a guide, they usually try to keep them minimum of 10 years, for a minimum of 10 years, or until they reach the age of 21, whichever is longer. So the whole thing is we want to keep them, just to be on the safe side, to keep them protected for as long as we can.
And that's for a person with fully developed RHD?
Yeah.
What about children that have been able to detect it early on?
For rheumatic heart disease?
Yes.
Yes, because it's so endemic in our setting in Fiji, we put them on for, even if they're not.
Well, is it a really strong medication, though, and does it affect their immune system adversely, though?
Thankfully, it's not. It hasn't. They get the usual. It's an injection. They'll get the. It's not painless, but they seem to do well with it. And unlike other antimicrobials, antibiotics, it's not developed resistance yet, which we're thankful for. So because they're on it for a long period of time.
I've had penicillin shots in the past, and it is quite uncomfortable, so I can only imagine what it's like for children. Now, Ziad, you were asking the good doctor about her work in the public health sector, being an advisor.
So what is that program about, the RHD program in Fiji?
Thank you, Ziad. So the program is, we sit within the Ministry of Health. We're Ministry of Health, we're a government program, and we're in the 4th year now of it, and it was set up in partnership with this organization called Cure Kids, New Zealand, which is supported by the New Zealand government as well, but in partnership with Fiji Ministry of Health. They set up this program because it was, seen to be a big a problem in Fiji. Set up and then we're aiming to, by the middle of next year, to incorporate it as as a fully Ministry of Health run program.
In your capacity, are you able to comment on the instances of RHD in developing countries in comparison with countries that are already industrialized or well developed?
Good question. So globally, if we look at the patterns of rheumatic heart disease, it was something that was more common in like the 20th century. Century, but it comes to it speaks to the risk factors, that what actually causes it. So with the improvement in infrastructure, in development, in the improvement of socioeconomic conditions as well, it's gone down. It's declined in the high income countries, but it has, as of the 21st century, most of the high income countries, it's more or less non-existent. However, it remains in the low and the middle income countries, and why it's declined in the already alluded to the improved thing, and because of the use of benzathine, penicillin as well. But with our less developed infrastructure and health systems and
just very quickly to end it off, looking at Fiji and the numbers that we have here for our population size, is it a good or bad sign?
The problem of the numbers. Well, I'm not going to say we've got one of the highest rates. So a global burden of disease study that was done out of Seattle, Washington, looks at all the numbers around the world, just published last year in the New England Journal of Medicine. It showed that Oceania, which Fiji is a part of, had one of the highest rates of prevalence of rheumatic heart disease and of premature deaths from rheumatic heart disease. And then, after that was Sub-Saharan Africa and the others one. But Oceania is up there. We've got her numbers.
I'd like to discuss the work that's being done with Open Heart International, but we'll be back with more after the break. Welcome back. Now, Doctor, getting back to RHD, before we have a talk with Mrs. Tokarua, looking at the work that the RHD program is doing right now, of course you talked about how it's been set up, but what is it doing?
Sure. So we have a few main few main objectives that we try and accomplish. So one is setting up a national database, like we alluded to before. We've got about 3,500, almost 4,000 now. So just trying to clean that data, get a repository where we have all their details, so that we're able to, the whole purpose is able to follow them up with their treatment, ensure that they are taking their treatment, because we have a very mobile population, track them down and make sure that they're getting their treatment. That's one. Another part is the early detection side. We're trying to pick them early, so screening. That's still, we're having a pilot program right now where we've trained nurses in the school health team. When the school health teams go out into schools, we've trained two nurses, and we're piloting it in Suva at the moment to see how feasible it is. Other nurses are giving injections, immunizations. Our nurses are doing the heart scans for year sixes just to see if they've got it. And, obviously we want to detect it earlier so we can put them on treatment earlier and prevent complications.
Sorry. Just looking at the data repository that you were talking about, I did a little bit of research and I found out that RHD Australia, they happen to have a central data repository, and they then send their data collection system sends it over to the Commonwealth, and they always follow up on that. What are we doing in relation to that? You said that we're trying to set up right now, but how is that going so far?
Well, it's taken a while. We started with a very basic database in, I think, 2005, and we've come a long way since then. And right now we've got a database we call it a rheumatic fever information system that's online. So it's web-based, and we're trying to make it accessible to the clinicians out there as well as us, so that when a doctor is seeing a patient, wants to check what he's on, if he was diagnosed with RHD, he can click onto our information system and check.
Are you liaising with any other stakeholders to get this set up?
Yes, so so ministry is driving our health information unit as well, but with help assistance from we outsource the IT side of things to private providers to help set it up.
So we also have Mrs. Tokorua with us, Geraldine, in the studio, and she is the mother of a child who was diagnosed 5 years ago with rheumatic fever. First of all, welcome to the show. Thank you so much for joining us. We'll start off with just your general experience as someone who probably wasn't aware of what rheumatic fever was. When you first found out that your child is being diagnosed with rheumatic fever, what went through your head? What was your initial reaction?
Okay, as I remember vividly on that day, I was devastated. I was terrified because, first of all, I didn't know what rheumatic fever was. And second of all, it had to do with the heart. And anything to do with the heart is scary. And to hear the doctor say that, okay, your son has to have his injection today and to go on every 3 weeks till we are advised to stop. So I was scared. I felt helpless. I didn't know what to do to have my son, who was not born with the disease, and thoughts going in my mind, what went wrong? What did I do? How this happened? So it was pretty scary.
I can imagine what a scary experience it must have been. So your child is 10 years old?
Yes.
And how is he doing now?
At first, it was harder at first, but then 5 years journey with having to have his Benza every 3 weeks. He's a normal 10-year-old boy. He loves rugby. He loves the outdoors. He's doing pretty well in school. And the disease that he has never stopped him from being a 10-year-old child. And this is only because that he takes his 3 weekly injections and he's able to do what he is, that he's doing now because of the Benza, and that we make sure that we take him for his injections every 3 weeks.
Well, Mrs. Tokora, looking at your son, I think he's a very brave child. I was just wondering, for all the other children out there who happen to have rheumatic heart disease, sometimes you do hear cases where parents don't take their children for more Benza treatment because they feel that the child is well enough. Why do you think that happens from a parent's perspective?
I guess what we're essentially trying to get at is that did you ever just feel like, okay, look, I can't see anything visibly wrong with my son, so why should we continue to get these 3 injections per week, and why should we go through the inconvenience? I mean, a lot of people must think that way, right?
Yeah, okay. Sorry, but this is my son. And you wouldn't think, and no one would think, that he has rheumatic heart disease.
Right.
Yes, some parents would feel like, okay, my son's doing okay, he doesn't need it, but it's the heart that we're talking about, and we don't see what's going on inside unless we are being checked at the medical facility. Once you know what's going on inside, then you can say, okay, whether he needs it or he doesn't. But to physically say, okay, he looks well on the outside, and you say, oh, he looks well, but what's happening inside is a different story.
Well, what about, how you're a parent and you have a child? Sometimes you take your child for treatment and they get jabbed with an injection all the time. Yeah. They don't want that.
I mean,
have you been able to explain to your son about exactly why he needs it, and has he actually accepted the fact that he needs to continue on his own without you having to tell him that he has to go for it?
See, like I was saying before, when he was 5, the first few weeks, first few months, even the whole year, first year, was hard to see your 5-year-old son get stabbed every 3 weeks. But it was later, until he was a bit old enough, that I was able to explain to him the reason why he needs his injections. And so far, for the past 2 years, he's the one that marks the calendar and reminding us my injection
Right.
is on this date.
Well, that's brilliant, and I'd like to talk more to an actual patient who had heart valve replacement surgery done as well, and we'll be talking to the doctor later on in the show. Stay watching for more after the break. Welcome back to the show and welcoming our new guest, Iwane Davoilati, an 18-year-old rheumatic heart disease patient, and of course continuing with our guest from the previous segment, Mrs. Tokoro, the mother of an RHD patient. Looking at you, Iwane, you are 18 years of age, you go to school, you're a high school student, and you had heart valve replacement surgery done at the age of 11. How's it been? What's your journey been like?
After the surgery was kind of weird feeling, because I've never had surgery, and especially with the new valve in, it was I had this awkward feeling, weird feeling, but I learned to get used to it, and it's part of my life now, and yeah.
When all of this was happening, you were just 11 years old. At that time, did you fully understand what rheumatic heart disease was? Were you aware of what was happening to your body?
Honestly, I didn't know what RHD was. I didn't know what was going on with my body. All I knew was that I was sick, and that was it. I never knew.
So it's major surgery at such a young age, and of course, boys being boys in Fiji, you want to participate in so much. Mrs. Tokura talked about her son, but he didn't have any surgery as yet. You had surgery. What was it like growing up in Fiji? You wanted to participate in certain things. Did it stop you, the new valves?
The doctors, I was restricted from playing contact sports, which I love to do, especially rugby. And right now I'm just doing other stuff, other things I'm interested in, because this world is big. There's more out there than you think, And yeah.
What's your support system like? Family and friends, schoolmates?
Support from family has been great. They're very supportive. Everyone knows that I've got this disease. They've accepted it. My friends, they're also very supportive. They know, and they always look out for me. And yeah.
Are you still continuing with your benzo shots after your heart valve replacement?
Oh yeah, I'm still on my monthly benzo injections, and I'm on medication for the surgery, and I have 3 monthly visits to the hospital for blood tests.
Right, so one of the key messages that we wanted to pass on to the members of the audience that are watching us tonight is the importance of continuing with your medication. Was it ever, did you ever come to a point where you just wanted to, give up and stop taking that medication? Did it ever become difficult for you to continue?
Yeah, sometimes I felt like giving up, as it was hard going through this sickness, but then I learned to accept it, and yeah, it's part of my life now.
I'm very humbled by what you've been through, and I wish you all the best. Looking at Mrs. Tokarua, of course, you've got a son right now. He's 10 years old. What do you think he's going to be like when he reaches Iowane's age, continuing with the benzo?
Looking at Iowane, not only Iowane, the other RHD, people living with RHD, our patients, just seeing them at that age and looking at my son, and because we are going to keep taking him for his benzo injections, and nothing is ever going to stop him from becoming what he wants to be in life, enjoy rugby as a young boy. So he has a life ahead of him.
I've got a question for both of you. Turn by turn, you could answer and let me know. How has it been liaising with the health ministry and the doctors and the nurses?
So we understand that the RHD program is a big support network, And what happens in that network? Like how do you pass on information or experiences?
Okay, so for starters, I didn't know what rheumatic fever was until 2 years ago. Rheumatic heart disease in detail, what it was. And this only happened with a support group that the RHD program holds. So it was one of the support group that we were invited to that I was educated more on what rheumatic fever was, what rheumatic heart disease, how you get it, and the preventions. And the RHD program has done a very good thing with support groups, and we're continuing with all these support groups to educate families who don't know what rheumatic fever is or rheumatic heart disease.
And yourself, Ioane?
Just like what Mrs. Tokoro said, I also didn't know what RHD was until the group reached out, and it's been a great experience. It has broadened my knowledge that there is NCDs. There's a lot of diseases and these symptoms that like a part of our daily lives that we don't know that it might lead to something big, might get worse, and yeah.
What's your message to those out there, like we spoke about, those who are actually suffering or who have just recently been diagnosed with it?
My message to all people living with RHD is just to keep on taking your Benza, even if you feel well. And if you have defaulted, please do come back, take your injection, because it's the only thing that will protect you from severe heart damage.
And Mrs. Tokoro, this might be the last time we speak on this show. To those parents, because I mean you're a parent, you've got 5 years of experience with this. To those parents who may be deciding to discontinue medication or already have, what would you like to tell them?
Like Ioane has said, Benza is the only protection that we have from this bacteria, and from further worsening the disease, the condition. So if you default, if you discontinue having to go for your injections, you're at risk, you're vulnerable to having many more episodes of rheumatic fever, further damaging your heart.
Thank you for coming onto the show, and we wish you all the very best for you, your family, and your son, and of course for you as well, Ioane. We'll be back with more after the break, and we'll be joined by Dr. Sainimaire Bola-Nduandua, the Public Health Advisor of Fiji's RHD program. Welcome back. Welcome back to the show, Dr. Bola-Nduandua. Getting back to RHD and the work that's been done along with the other relevant stakeholders, you had the Open Heart International team that visited Fiji and performed 30 free surgeries on adults and children. Now, of course, not all 30 of these surgeries were for rheumatic heart disease. Could you tell us about how that's been going? Because as I understand, it's an annual event?
Yes, so one thing that is important to note is that surgery for valve replacements, for rheumatic heart disease, it's not available locally. We rely on these overseas teams to come and do these surgeries. They're quite complex, and we don't have any local cardiothoracic surgeons. So we rely on teams such as Open Heart International, who've come, Friends of Fiji Heart Foundation, they also come. There's a team that come from New Zealand, Australia as well. So yeah, they come in once a year and do these surgeries.
And those who are eligible for these surgeries, they don't only come from the Central Division. You source them from all over the country, and you get them in. And do you provide housing, or do you provide treatment costs as well? Post treatment, that is post surgery.
Yeah, so yeah, they come from all over. Our doctors in our various different divisions, they have they have a list, and they have criteria to go through to try and shortlist the ones who get on the list, and they try and get them over to The surgical teams do this with the ministry, not aware of on the particulars of assistance that they provide, but what I do know is that it's surgery that would otherwise be done overseas. Sorry, that's the other option. They can, if you have insurance, you can send your kids, the person with who needs surgery overseas as well. But for us, for these teams to come and do it here, that's a big help to them. So they make the effort to come and.
So for surgeries, of course, you rely on international teams to come in and help out, as you've mentioned. What about training our local medical professionals here, doctors and nurses? Is that being done?
In terms of surgery?
In terms of post-surgery, in terms of taking care of
medical
patients?
Expertise that we have in Fiji to better deal with RHD?
Sure. So that's one of the arms of the Rheumatic Heart Program as well. We're more to do with the prevention side. So a key part of what we do is also training. So training the health professionals, the nurses, the doctors, village health workers, community health workers. So we provide that as well to try and just provide refreshers for them, and so that they have they're up to date with the diagnosis.
Before we move on to other work that Rheumatic Heart Disease Program is doing in Fiji, just a quick question. Ballpark figure, would you be able to tell me how much each one of these surgeries costs?
No, I'm sorry, I don't have that figure in my head.
Well, that's perfectly fine. So the Rheumatic Heart Program has been doing a lot of advocacy in Fiji. We hear about we hear your ads on radio and on television. What else is in store? What does the future hold for the Rheumatic Heart Program?
Thank you, Ziad. So the next month of September, we're having a month-long awareness campaign, multimedia. We're just going all out because we chose September because September 29th is World Heart Day. So all these activities will culminate on that day, where we'll take about 70, 80 of our young people living with RHD out, and we'll celebrate it at the Outrigger with their kind sponsorship. But in the lead up, the whole month of September, we want to raise awareness of rheumatic fever and of rheumatic heart disease. Most importantly, rheumatic fever, for people to know to recognize the symptoms. If they see school-age children, sore, swollen joints, sore throat, think rheumatic fever, and get them checked. Like take them to the nearest health center and ask, could this be rheumatic fever? Just want to raise the awareness of that.
And are you looking to grow your support network, have more perhaps partnerships like the one that you have with Open Heart International?
Yes. So, we have all these stakeholders and teams coming in doing their things. We would like to work more together, obviously. It's a no-brainer. We often do things in silos. And so we are talking with them, with Open Heart International and Friends of Fiji as well, to synergize our efforts and also be talking with each other, so that there's a continuum of care, with the prevention side, the surgery side, the post-surgical side, like you were saying too. And so we're offering the people like a more, broad services and not just focusing on one.
We're just about to wrap up the program, so any last few words?
Yes, so, this whole thing is trying to raise awareness about, the month of September will be, our slogan is Heart to Heart. We'd like to get everyone talking about rheumatic fever and rheumatic heart disease and the link. It's a bit of a mouthful trying to explain the links and all that, but if anything, for people to just be aware of and recognize the symptoms. You have a child, a school-age child, primary school, high school, if they, showing any of these symptoms that we've been talking about, sore throat, sore swollen joints, think could be rheumatic fever, and please get them checked at their nearest health center or hospital.
Thank you for that.
Well, thank you very much for coming on to the show. That wraps up our show for tonight. Should you feel the need to know more about rheumatic heart disease, be sure to consult a medical practitioner at your nearest health facility or call Fiji RHD Program on 331-9348, and you can also find more online on their Facebook page, Fiji RHD. And until next time, have a pleasant evening.